Hello and welcome again to the Voice Spotlight. Tonight we have two young ladies from a LLC. LLC, am I correct?
Nonprofit.
Nonprofit, Care Prepared, and I'm going to let them introduce themselves before we get into our questions. So have at it, ladies.
Okay, I'll go first. I am Tammy Turner. I am the founder and the president of Care Prepared, a nonprofit that makes it easy to learn about, talk about, and document advanced care plans.
Okay. Ashley?
All right, good evening, everyone. My name is Ashley Johnson, and I am the treasurer of Care Prepared. Thanks for
Okay.
having us.
So we met in Glen Burnie at Pastor Kissick's first annual Fall Festival. And I knew right off the bat this is some information that needs to get out. So I am hoping that everyone uh, takes my stance at it and learn about this because I have something similar to this, but I think this is a little bit unique than what I've heard. So, Tammy, since you started with the nonprofit, what exactly is Care Prepared and why should people give thought to it?
Great question. So, Care Prepared is, as I mentioned, a nonprofit organization, and we just try to help people understand advanced care planning, which is creating healthcare decisions and documents ahead of a medical emergency. So, it's really important to think about and document and be aware of what options are before you actually need it. So our mission really is to try and make it as easy as possible to have those conversations, to provide the resources that folks may need, and really do it in a way that meets people where they are.
Okay. So I met the both of you, like I said, at the first annual Fall Festival with Pastor Kissick. Um, how often do you go out and do something similar to where we met you at?
So we try to do that as often as possible. So just as an example, for this past year, we've done probably 35, 40 outreach events and reached over, I think we've hit about, in this past year, over 1,300 people that we've been doing.
Wow. Okay. So you said you're the founder, correct?
Yes. Yep.
Okay. So um, how did it come about? Everything has a origin story. Everything has a start. How did it come about?
Yeah. That's also a good question. So personally, um, I had the experience with my parents. My parents were planners and told me that they had everything covered. And then my dad actually had a medical crisis and was in the hospital. And my mom was the person who was supposed to know all of the decisions he wanted to be his medical spokesperson. And she had to leave the hospital and couldn't be reached. This was in rural North Carolina. And so they couldn't get in touch with my mom. My dad's health deteriorated, and I had to make some decisions on his behalf. And I really, to be put in that position when you're in a crisis situation already was just one of the hardest things to go through. And I just kind of came to the realization like, well, if these folks thought they had all the information they needed and they didn't, how many other people are in that situation? And how many other family members are going through, caregivers are going through these really difficult, trying times when you could have had the conversation a lot sooner and you could really just then be present in the moment and get through the crisis without having to have that extra layer of stress.
So, and I think I mentioned to the both of you that a couple weeks ago, um, we had a guest on that talked about caregiving and what she is doing to bring caregivers um, together to understand what they're going through, why they're going through it, and that there are ways to go through it and have a network of people going through it. And then a little bit further back, I had a guest on that found herself in the caregiving position from a sudden illness during COVID that she hadn't planned on. So this all plays into this. So Ashley, I may have spoken to you first before I talked to Tammy. What is your role with Care Prepared?
So I serve on the board. I am the treasurer. But this topic is near and dear to my heart. You just spoke about caregiving, and November is actually National Caregiving Month. And caregiving is something very special to me. And that's why I was drawn to this organization and drawn to Tammy's vision and mission, because I would love to educate every caregiver about what you can do to prepare for a medical crisis. And so that's kind of how I landed here, working for different organizations and talking to different family members, in addition to my own personal experience.
Okay, so how long has the LLC been? I keep saying LLC because I'm helping people form their companies. I'm sorry, and I should know better because we just started our nonprofit or really got it into second gear. So how long has the nonprofit been, I guess, active? How long has it been active? Because sometimes you start it, but you don't get active till later, and I speak from experience. So, but we're shifting in the second gear we're going. So how long has it been active?
So active, we went live with our website December of last year. So we are just about 1 year old with the website. We were incorporated as a 501c3 nonprofit in August of 2023.
Hmm.
So you are correct, where it's a process.
Yeah,
But honestly, since our website went live, things have just really, you know, moved forward at a much faster pace than I think we expected, in a good way, right?
yeah,
Like all good things.
yeah. We're anticipating that for ourselves. So, Care Prepared, who is your target client base or who's your target audience?
Anyone over the age of 18 really should, at the minimum, identify somebody who could speak on their behalf if they had some sort of accident, medical crisis, because that can happen to any of us. And once we're an adult, we get to decide who that person is that could speak on our behalf. And not everybody, it automatically can fall into certain people legally, but not everybody would want that person. Um,
Yeah.
Even if it is legally the person who could speak on your behalf, you actually have the option to choose who it is.
Okay.
And if I can add, and also everyone may not have that support system in place. So solo agers is a big thing. A lot of people don't have children to list as their person or their healthcare proxy. And that's why it's important to name who do you want that close friend to be, or that neighbor, or maybe your best friend from second grade, whoever it is. If you don't have children and something happens to you, you don't have a spouse, which is common, who is going to be that person. So I think the structure of family looks a little different now. And so that's why it's important to list this stuff.
Yeah.
So I never thought a neighbor could be. I guess that's kind of unusual. Does that happen?
It does, because I think people choose different people than just your blood relative to be able to step in and step up for you, right? I think the other thing to be aware of for the audience of who really needs to make sure they have this documentation and is aware of this information, in addition to anyone over the age of 18, it really is important if someone has a serious or a life-limiting illness, a dementia diagnosis or prognosis, cancer, any of those like really serious sort of illness diagnosis that can, as time goes on, can potentially be, get worse. It's really important. In addition, older adults who may have multiple health conditions that may, having all these complicated health conditions may make them more vulnerable to go to the hospital and have serious health complications. It's really important to be aware of the different options you have.
Okay, so I'm not sure whether you used the word document, but you gave me two takeaways when we met, and we're going to go over both of them if it's okay with you. So the first was Maryland, my directives. Um, and again, it's a first for me. I've never seen the document or anything about it. So could one of you tell us about Maryland, my directives?
Do you want me to jump on that, Ashley? So, the Department of Health for the state of Maryland has been, and probably within the next year, you'll hear more, maybe from a public awareness campaign, really trying to help people understand that there are online versions of doing an advance directive. One of the misconceptions is that people have to go to an attorney or someone must notarize this document, and that's not the case. You can create an online version of your advance directive, and it's free, and it is connected in our state, in the state of Maryland, to the Health Information Exchange called CRISP, which is then accessible to all the hospitals. So it's a really great option to get all these documents in one place and then be able to be shared electronically. So we're really excited to try and get that word out, because again, it just makes it accessible for a lot of people.
Okay, so over a few years, I've been um, subjected to the question of when you go in there, do you have an advanced directive? So with this, prior to that question being asked, as you come in, they're able to access it through CRISP and
So
that question.
of course, there's a little bit of a challenge because nothing's ever easy, right? And no two health systems in and our health structure is very challenged. I think it's a good way to say it overall.
That's the polite way
Uh,
to say it.
yeah, it's a polite way to say we have some challenges within our healthcare. So it's a step in the right direction. It enables you to, if you've done documents before, you can upload them. If you haven't, you can follow a very easy, the platform's very user friendly. You can create your advance directive, and it gives you the option to share it with your healthcare provider, with your neighbor, with your child, with your spouse. It gives you the central place to hold all these things and then share it out. But it's on you as the patient or the public to take those steps. It's not automatic.
Okay, so we spoke before that the age of 18 is for the caregivers. So my directives, is that also a document that has an age range or beginning?
18, legal adult in Maryland.
Okay,
Mhm.
all right, all right. So you may have to want to tag team on to the next one. Then second phone you gave me was five wishes, and I hope even my light doesn't wash it out. Five wishes, and you may want to tag team on it because after, and I actually sat in um my implant. It's another term. I was looking at implants, but I sat there and I read through the five wishes, and it might be a little labor intensive, but telling somebody about it and them not knowing what it is might be a little challenging. So if you don't mind, and you don't have to spend any great amount of time on this, can you go down the five wishes? Do I have to read them out?
So I could talk about it generally, and then we
Okay.
can dive into
Okay.
the
That'll be
details of
good.
it.
That'll be good.
So Five Wishes was developed as the first advanced care plan to address the personal, emotional, and spiritual wishes of someone, in addition to medical treatment. So it's used to really highlight what's important to the person. So you can use it to define a roadmap of how you want to be cared for when you can no longer speak for yourself. So it's been embraced by different families, different organization, faith groups. It is really a community tool to use in layman terms, without all of the medical jargon, without all of the legal words, just kind of really simple. How do you want to be cared for at the end of life? So it really becomes more than a workbook, but it is a legal advanced directive when you complete it. And it really sheds light on the person-centered advanced care planning that is needed to have that important conversation. But you can walk away with it and have two witnesses, sign it to say, these are my wishes. I want you to be able to, if I can no longer speak for myself, I want you to follow this roadmap. And this is how I want to be um, treated, or yeah, treated medically at the end of my life. So it really is just that, a roadmap to how you want to be cared for at the end of life. And it's just a conversation starter too. I bring it out Thanksgiving dinner. I hand them out. I said, we need to have this conversation,
At
because
Thanksgiving,
at Thanksgiving, that's the perfect time,
guess you
like
got a
Tammy
captive
said.
audience. Everybody's in one room.
Yeah, and our audience in one room, it is a tough conversation, but it's an important one. And I think in some communities, especially the African American community, it's just a topic that we don't talk about. It'll get there when we get there, and then families are stressed out at end of life situations, and siblings are bickering back and forth. So it helps eliminate all of that. And that's what I do in my community when I educate folks about this. It's a peace of mind, really, So let's talk about this beforehand, before crisis, and then everyone is on the same page. And I'll let Tammy go into what the five wishes are. But that
Okay.
was a little general oversight.
Right.
No, I think that's great. I mean, I don't know that we need to spend too much time
Okay.
diving into each wish.
Right. Because that
I
that
think
that did cover.
yeah, I like that tool. Especially like Ashley said, it's used in language that's easy to understand. If you were to go on the Maryland website for the Attorney General and download the advance directive, that's what the legal advance directive is in our state. It's very legalese. It's very challenging to kind of break down. This document covers the same thing, provides the same coverage. It's the same exact, it's a legal advance directive, but it's easy to understand and easy to navigate. Um, so yeah,
Yeah.
totally.
So and the weirdness is I didn't think about bringing it up. And when this airs, it'll air actually the day after Thanksgiving. But my family will be here from Florida. So I know the Maryland My Directives is basically state centric. But Five Wishes, it is national.
As my directives is national as well.
Ah.
Maryland's the only state that is sort of partnered with them to create our own version, our own health record system that's connected to the hospitals. Other states have access to my directive platform, but Maryland's the first state to really kind of lock in and say we want it to be accessible to all Marylanders.
Wow, a first for Maryland.
Mhm.
So, one thing that I noticed and about Five Wishes, and it seemed more personal from the level of the person that's creating it or
Mhm.
composing it. Um, but maybe 2 years ago, I uh, opened a policy with Lincoln Heritage, and they have a similar set of, let's call them wishes since we're on that term. Um, And I think the question is going to come up because some of the people that will look at this have been, um, either they are policyholders with Lincoln Heritage or such. Um, is there any connecting thread between, how do I want to put this? Is there a connecting thread about what is offered by a Lincoln Heritage or a similar company and Five Wishes? Or do they go hand in hand?
So, tell me a little bit more. Lincoln Heritage is like life
So
insurance,
Lincoln
or
Heritage is basically end of life insurance. It pays for the funeral
okay,
and everything, but in there, not so, and I'm not knocking Lincoln Heritage, not so personalized, like that you both said that this has, how like number how comfortable I want to be and how I want people to treat me. It's not that granular.
right. So,
So
so this is probably a very complementary piece to that, and it is very personal because we're all very different with what respects to what we want, right? So this tool gives the prompts and the questions and sort of helps. I like one piece of it is that it actually gives you suggestions to mark off instead of you having to think of things yourself. You can say, oh, that doesn't apply to me, and just kind of cross it out.
I noticed that.
Yeah, I personally, I'm like, well, that's good. Then I don't have to come up with all this stuff on my own. It kind of gives me guidance, and kind of, ideas of things I do or don't want. And then it's got potential and openings to write more, right? If it makes you start thinking of things, you have access to, writing whatever is important to you.
Okay.
I agree. And just to add to what Tammy said, it's a conversation starter. And I think those not only while you're still living, but even how do you want things to go even after I'm gone? I think those conversations are important as well. Good example, my grandfather didn't want a big funeral. He only wanted immediate family at the funeral, you know. He didn't want songs, he didn't want flowers, he didn't want to spend the money on any of that. And he made those wishes known. And as the granddaughter, I had to respect those wishes. No matter what the second cousin wants, down in North Carolina, I had to really respect those wishes. So I think it starts the conversation, but even how do I want to be honored, post death, type of thing. So I think it goes hand in hand with that particular insurance company.
Yeah, because I've been around a while and I've seen a lot of situations where um one person said, she would have wanted this or he would have wanted that. And, after I know I'm a little bit, I don't want to say cynical, but you tend to listen and you tend to see and you tend to formulate that sometimes the things that family members want to do is the things that they want to do. Um, and I spend amount of time on some of the social media and I see some things that don't make common sense to me. And I don't know, sometimes I think it's not honoring the people. So something like Five Wishes is definitely making your thoughts and presence known because they are some things and I've been aware of some people that just didn't want anything big. Some people didn't want it to be a sad affair, or they wanted jazz music played because they were into jazz and they wanted people to feel that, they're doing what that person wanted to do in life. So, um, not knowing about it when you handed it to me and then looking through it, um, even with the trust I have and even with the Lincoln Heritage type insurance, I can see this as a plus to someone kind of should be paying attention to it. And I think, do you find, because you guys are really on the battlefield for this, do you find that there is an irrational, and forgive me if that might not be the word for it, that there's just, for whatever reason, a pushback for doing documents like this or paying attention to it?
Yeah, I think so. Ashley and I both come from a hospice background, worked together in a hospice organization. And, once you're in that stage, it's part of having this conversation is part of the hospice care. And we both recognize it's too little too late, that these conversations should have happened a long time before
Mhm.
that part of a person's journey. But I think it's just they're not easy conversations, and they're not um, you know, it has to be somebody that's currently, I think it's harder to get resources. And that's part of the whole reason why we started this organization, is to try and make it easier and normalize the conversation and provide the resources, and somebody that could have the conversation if, say, you don't want to do it, but you could direct somebody to us because we're comfortable doing it.
Yeah, and I will add, I think not necessarily a pushback, but people are just ignorant to the fact that they know this even exists. They know, that it's offered for free, that you can go to your local area agency on aging or your hospital to get it done. I think people think that, oh, I have to have a lawyer and lawyers cost money, and so those barriers right there, I think people are just like, oh, I don't need that yet. I'm healthy. I don't need that yet. And it's maybe not until you experience it firsthand where you have a colleague your age that had a heart attack, or whatever the case may be. You're like, oh, this can happen really to anyone. And I think it's a mind shift that we have to really educate people about, that's why anyone over the age of 18 needs to start having these conversations, because you can go out tomorrow and get hit by a bus. You don't have to be old. You don't have to be in a nursing home to start having this conversation. And so I really think Tammy has created something to make this normal, to really create these educational experiences and this just educating folks. The National Healthcare Decision Day, Tammy, we set up a table in my lobby where I work, and I was just, people will walk by, and I said, do you know who you want to, have speak for you in case you can't? And they was like, I never thought of it that way. It's just like an aha moment. And so I think that's a part of our mission, is to really get that aha moment into people's minds before they need to be really thinking about it. So I think that is kind of where the pushback might be, just not knowing that this exists. This isn't, it's not gonna cost me much, if anything at all, because we offer these Five Wishes booklets at all of our events, and they're free for the public, and they're legal documents. And so I think that is the mind shift that we have to start pushing.
Yeah, and I have to be in all transparency. Uh, the me in the 20s probably wouldn't have thought about it because I thought I was invulnerable. The me in the 60s realized that I'm not immortal and that, you know, like you say, I can get hit by a car, but just if you are looking at me, I'm getting, well, I've just turned 69, but you start looking at things different, that you're not going to be here forever. So I can see this. I think Jeff Exum was with me, and he was saying that we would probably, tap into you ladies and come to an event or something that we were doing. And I can see this. I'm hoping that the spotlight that we're on right now itself will start the conversations. Um, but I sometimes you need that hands-on, and it's like the children don't listen to dad all the time. They might want to listen to somebody else. So might want to bring you in here. So and and we're winding down and looking through this. I ran into, I don't even want to pronounce what it with moist, MOLST. What's the pronunciation of the acronym?
It's the most form.
Most, the most.
Hmm.
Okay,
Yep.
so Um, again, I ran into that, and if I've seen it before, and I think I have, but I never paid attention to it. So could you speak on that a little bit?
Do you want me to jump in on that one, Ashley,
Sure.
since
Yeah.
it's so the MOLST form, it stands for the Medical Order for Life-Sustaining Treatment. And it is exactly that. It is a written order by a physician's assistant, a physician or nurse practitioner. And it is the actual thing that medical professionals such as EMTs and folks at the ER, it's what they're going to follow because it's a medical order. And it starts on the first page. It's all about CPR. So way back in the day, used to hear about something called a DNR, or do not resuscitate. This is that and more, because as time has gone on, we have a lot more medical interventions that can keep us alive. So on the front page, it's all about CPR. On the back page of the MOLST form, it's about additional things that can be provided to someone, such as ventilation to help you breathe,
Nutrition.
artificial, yeah, nutrition. There's several different a la carte options that can help keep people alive. So it's really, really important to have that first page about the CPR filled out if someone does not want CPR. Because if they don't want it, they really need to have that filled out. If that form is not filled out and they have a cardiac emergency, currently all of our EMTs, our paramedics are trained to provide CPR unless they see that MOLST form. So you could have somebody 90 years old who has said very strongly, I don't want CPR, I'm ready to go. They have a heart attack, and those paramedics can't find that form or don't have access to it, and they're going to perform CPR on that person. So
Okay.
that's one piece that we really just try and educate, especially our older adult population, to speak with their physicians to really get at least that first page covered, because the second page, you can you can be aware of it and understand what the interventions are, talk to your healthcare person, your healthcare agent, be aware of what you would or wouldn't want. You don't have to fill out that second page, but that first page about CPR is really, really important if you don't want it.
So you brought up, and this was not a question that I had planned on it, but you touched on, in touching on the form, you touched on something that's, I guess you can say, is near and dear to my heart. I am CPR. I am a CPR trainer. I'm certified with both American Heart Association and American Red Cross. So, and I guess because when you spoke about it, because again, if, you know, since I am trained and if I saw someone go into that, I would start CPR immediately. And I've been trained to keep CPR up until a trained EMT or emergency personnel get there. But if there are other CPR trainers or people that have the certification to do CPR, and this form exists outside, of course, we wouldn't know, but we
Mhm.
are protected by the Good Samaritan
That's correct.
law, which is Maryland. Maryland has the Good Samaritan. So yeah, it just hit me that someone may have that in this form, but I'm already going into it because I'm trained to go into it.
Mhm.
Um, and I know of at least one occasion where somebody, let's say, pushed the envelope and thinking that a rib was cracked during CPR, and that's very hard to do. Not impossible, but very hard to do. But I do know people that have, hey, they didn't want to be resuscitated. So okay.
And I think the piece that, especially when Ashley and I are talking to older adults, it's just important to be aware. And you can make, I mean, everybody has the right to make the choice, but just to be aware of what CPR does at different stages. Like, CPR on a 40-year-old body looks really different than CPR on a 90-year-old body.
Or
And the
infant.
right. So, that's part of our education and part of the piece that we try to make sure people get all of the information to make that educated decision of what works for them and what they value and what matters.
Okay. So I usually say, talking directly before you leave to talk directly to the people that might be watching this. But I think a better question would be um, when they reach out to Care Prepared, um, what should they expect? I guess that should be a better question than talking to somebody. So somebody's interested and they're looking at this and my directive is set off a little light bulb in their head, and then the five wishes set off a light bulb in their head. And of course, you would be the person to speak to. So what should they expect when they contact the nonprofit?
Yeah, I think, and Ashley, I want you to jump in too. I think they should expect to get as many resources and information as they want. I think we try to really meet people where they are and with respect and with giving people the information in a way that matters to them and how they want to hear it and at the time and pace and all of that stuff. We really do try and make the information accessible, but also personal.
And I would just add, from a macro point of view, is, what can I do now? How can I educate my community? Maybe I should call Tammy and see if my church group wants to have a session or my book club wants to have a session. Where can I get these resources so I can share with my friends and family? Where can I get a stack of five wishes for Thanksgiving dinner or Christmas dinner? So I think if you take a piece of that, or maybe you get it. Maybe you know how important this is because of a personal experience. How can I give back? We're always looking for volunteers. We're going to start our volunteer program very soon, hopefully top of the year. So maybe I want to educate others about this program. How can I solicit donations to help this wonderful organization keep going and keep growing and educating all parts of Maryland? So it really depends on where you are in your journey. If it's self, how can I educate myself? If you got it, let me educate other people. Let me reach out and figure out how to connect Tammy to these other pockets in Maryland, in different groups. And I really think that that's a starting point. So I hope that answered your question. I hope you just take a piece of this to know that what can I do now, whether it's for myself or for my community.
And again, and this happens often when I have guests on and they're talking because things hit my head, because it's constantly running through my head, when I walk in the morning. I thought of these questions probably yesterday during my walk. I digest it all, and that's when I do a lot of my clear thinking. But you used a term that we use with our own Have a Heart to Help um, nonprofit and with our church, Victorious Living Faith, and that you're um, you're approaching and embracing the underserved. Some people may say, well, they may be homeless, near homeless, or low income, but their wishes should be respected like anyone else's. So if anyone's looking at this and they're thinking that, oh, have to have a certain amount or status in life, that's not true. Just over the age of 18 and being able to make a very conscious decision about what you're doing. Am I correct?
Correct.
Okay.
Absolutely.
Okay. So I'd like to thank you both for appearing on this spotlight. I like Jeff. I see that we will see each other again outside of this, um, whether it's for an event or just coming in to speak. Um, and we have a couple ministries at the church that may want to approach you with one or both of you coming to something where you can speak at. Now, I met you in Glen Burnie, and this is just a weird question. You guys local to us? to Baltimore area, the greater Baltimore area?
We're in Anne Arundel County,
Okay. All right. Well,
so
that's not too far.
not too far.
Just up Ritchie Highway. That's
Yep.
fine.
All right. So again, I appreciate you coming on. Like I said, I see that we're going to have some conversations, if not face-to-face conversations, about this. And what it was you, Ashley, about getting a stack of these? Uh, with the family coming in, I may make a run to meet one of you and get a few of them and bring it up. Um, you know, we're not getting any younger, and this world is not getting any safer. So, um, this might be something that they may want to embrace. I might try to do the Thanksgiving thing.
Thanksgiving, it's a great opportunity.
Great
It
opportunity,
might
or
be.
start slow with the conversation, and then by Christmas, everyone's warmed up. They thought about what they want, and then everyone fills it out together. So stuff it in the stocking. So
Yeah,
yeah.
I usually put this together, several days before it's actually released onto the YouTube channel, so maybe I'll show them early. But
Yeah,
um
absolutely.
let's where can they get a few of these 5 wishes? Let's end it with that. Where can we get a couple of 5 wishes?
I was going to say they can absolutely reach out to us, and our email is carepreparedinc@gmail.com. Go on our website, careprepared.org. You can reach out to us either of those ways.
Okay. Well, I appreciate you. We will be talking in the hopefully near future.
Thank you so much for the opportunity. This was
No
great.
problem. I enjoyed myself. Have a good evening and good night.